Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Lymphogranuloma venereum, or LGV, is a sexually transmitted infection that primarily affects the lymphatic system, which is a crucial part of our immune system. The lymphatic system is important because it helps the body fight off infections and maintain fluid balance. LGV is caused by a specific type of bacteria known as Chlamydia trachomatis, which is also responsible for the more common chlamydia infection. Now, LGV isn't as common as some other STIs, but it can still cause serious health problems if not treated properly and promptly. Early treatment is crucial to prevent complications, which can include severe inflammation and damage to the lymphatic system. The tricky part is that LGV often goes unnoticed because early symptoms are mild and can be easily mistaken for other conditions, such as a minor infection or irritation. This makes it really important to be aware of the signs and symptoms, which can include small painless sores, swelling of lymph nodes, and later, more severe symptoms. Understanding LGV and its potential impact can help you protect yourself and others from this infection. If left untreated, LGV can progress to more serious stages, leading to long-term complications that can affect the genitals, rectum, and even cause chronic pain and swelling. So seeking medical attention promptly is crucial to managing and treating LGV effectively. Chlamydia trachomatis is a type of bacteria, and certain strains of this bacteria cause LGV. These strains are different from those causing other chlamydia infections. LGV is spread through sexual contact, including vaginal, anal, and oral sex. The bacteria enter the body through tiny cuts or abrasions that can occur during sexual activity. Once inside, the bacteria infect the lymph nodes, which are small bean-shaped organs that are part of the lymphatic system. Chlamydia trachomatis is sneaky. It can be present even without noticeable symptoms. This makes it even more important to practice safe sex and to get regular testing for STIs. LGV often has mild symptoms, making it difficult to detect. The first symptom is usually a small sore, which can appear on the genitals or rectum, and it may also appear inside the vagina or rectum. This sore is often painless and may heal on its own within a few days, but the infection remains. Without treatment, LGV can progress to later stages that have more severe symptoms. Swollen lymph nodes are another common symptom, and these swollen nodes may be painful. They can occur in the groin, pelvis, or rectum. Other symptoms include fever, chills, and fatigue. Section 4. Diagnosis: Unveiling the silent infection. Diagnosing LGV or lymphogranuloma venereum can be challenging for healthcare providers. This is because early symptoms are often mild or non-existent, making it easy to overlook. If you suspect you may have been exposed to LGV, it is crucial to see a doctor as soon as possible. They can perform a variety of tests to check for the infection, ensuring an accurate diagnosis. A doctor will ask about your sexual history and any potential exposure risks. They will also examine you for physical symptoms that may indicate the presence of LGV. The doctor may take a swab of the affected area to collect a sample for testing. This swab is then tested in a laboratory for the presence of Chlamydia trachomatis bacteria, which causes LGV. Blood tests can also be used to diagnose LGV, providing another method of detection. These tests check for antibodies to the bacteria, which are indicators of infection. Antibodies are proteins the body produces to fight off infection, and their presence can confirm LGV. Early diagnosis and prompt treatment are essential to managing LGV effectively. This helps prevent serious complications and ensures better health outcomes for the patient. Section 5. Treatment: A course for recovery. LGV is treatable with antibiotics. The antibiotics are usually taken for 3 weeks. It is important to take all of the medication as prescribed, even if symptoms disappear before finishing the medication. Antibiotics help clear the infection. However, they cannot reverse any damage that has already occurred. Early treatment is crucial. It helps prevent long-term complications. In some cases, a doctor may drain a swollen lymph node. This is done to relieve pain and swelling. Surgery is rarely needed to treat LGV complications. Follow-up appointments are important to ensure the infection has cleared. Section 6. Prevention: Your best defense. Preventing LGV is crucial for maintaining your overall health and well-being. The most effective way to prevent LGV is to abstain from sexual activity entirely, as this eliminates the risk of transmission. If you are sexually active, use condoms consistently and correctly every time you engage in sexual activity. Condoms help reduce the risk of contracting or spreading LGV and other sexually transmitted infections. Knowing your partner's sexual history is also important in assessing your risk. Open communication about STIs is essential for mutual protection and trust. Regular testing for STIs is recommended for all sexually active individuals, regardless of perceived risk. This helps detect infections early, even if no symptoms are present, allowing for timely treatment. Remember, LGV often has no symptoms, making it easy to overlook. This makes prevention and regular testing even more important. By taking these steps, you can protect yourself and your partners from this infection, ensuring a healthier future for everyone involved. YIMCCC, your ultimate medical consultant connectors.